I'm Doug Daniel, PT at Cornerstone Physical Therapy, and this is basically our summary video for patellofemoral pain syndrome. So again, patellofemoral pain syndrome is pain on the front of the kneecap or on the borders of the kneecap. It's a very common running related injury, and it's definitely the most common knee related running injury. So the approach that we typically use is a multimodal approach, and this has been studied by Esculier et al. In 2015. And this multimodal approach addresses several variables, including training errors, strength, control, and then sometimes gait-related factors. So from a training error perspective, if a person is having pain while running, in all probability they're going to have to reduce the amount of intense running they do and how much running they do, at least for a short while, and try to get on track with a consistent a program dominated by easy running, and then start adding sessions or harder running back as their pain will allow. The second variable is strength. With these individuals, we do need to strengthen the hips. This includes the hip abductors, the hip extenders, the hip rotators, and then also the quadriceps and hamstrings. From a control perspective, it stands to reason to try to emphasize a posturing of the limb where the knee does not turn in and the pelvis does not drop. So with some individuals, a cue such as suggesting imagining headlights going forward, or a line between your knees or something like that, trying to help the person keep their knees out, and then maybe even practicing drills where they stand on one leg and control their pelvis and preventing it from dropping. And I'll probably post a few videos with some ideas on that. And then lastly, the gait-related variables. For some runners, it's as simple as just increasing stride rate, usually by 10%. So say a person's taking 160 steps per minute, it's good to try to practice taking, say, 175 or 178 steps per minute. And then also with some runners, especially somebody that's been dealing with this for quite a while, they've tried a lot of things and not getting better, it might stand to reason to try to shift their foot strike to more of a forefoot strike, because that has been shown to reduce patellofemoral joint stresses. So bring all these things together, and hopefully the person has a healthy return to sport and goes on with their training. All things being equal though, training error is the most visible issue with this population. So if you're a person that runs hard every day or even runs medium every single day, you're inconsistent with your training, you run a lot of downhill's hard, these variables need to be looked at hard and considered in addition to these other things.